Ovarian cancer is a disease in which cancer cells form in the tissues of the ovaries. The ovaries are two almond-shaped organs located on both sides of the uterus. They produce female hormones, and eggs are difficult to detect and can spread quickly. The ovaries contain many small glands that produce and release an egg each month during a woman's menstrual cycle. The ovary also produces female hormones such as estrogen and progesterone, which control the fertility and pregnancy cycle of a woman. In most cases, ovarian cancer begins as abnormal growths in the cells that line the surface of the ovary. These abnormal cells can eventually become cancerous if they continue to grow uncontrollably or invade other tissues or organs of the body. Before continuing, please note that everything mentioned in this video is based on impartial facts, verified and reviewed by qualified health professionals. That said, let's talk about 9 common signs of ovarian cancer. About 6% of women will develop ovarian cancer during their lifetime. This represents about 1 in 78 women. Ovarian cancer is more common in older women and among those who have never been pregnant or who have not had children. The American Cancer Society reports that about 22,000 new cases of ovarian cancer were diagnosed in 2021, and nearly 14,000 women lost their lives. Ovarian cancer accounts for about 2% of all cancers among women in the United States. The good news is that many women with ovarian cancer can be cured, but it is necessary to receive treatment as soon as possible after the onset of symptoms. Ovarian cancer often does not show early symptoms until it is too late for curative treatments. Most women diagnosed do not show symptoms until the disease is advanced. On average, the 5-year survival rate for ovarian cancer is approximately 35%. The survival rate depends on many factors, including how advanced the disease is when the person's overall health is diagnosed, and whether she chooses surgery or chemotherapy as the primary method of treatment. Ovarian cancer is more common in women over 63 years old, but it can occur at younger ages. History also plays an important role in the formation of ovarian tumors. If a close relative has had ovarian cancer, your risk is higher than average. If 2 or more relatives have had the cancer, your risk is even higher. Fortunately, there are many early symptoms that can signal the presence of ovarian cancer. But to better understand these symptoms, let's take a look at the types of ovarian cancer. There are 3 types of ovarian cancer. The most common form of this cancer is epithelial ovarian cancer. This type accounts for about 90% of all ovarian cancers and begins in the cells that line the surface of the ovary. However, ovarian cancer is less common. Germ cell tumors begin before birth or shortly after, so they can be found in children and teenagers. These tumors represent about 8% of all ovarian cancers, but most cases occur in women in their 40s. The rarest type of all is ovarian stromal cancer, which accounts for 2% of women diagnosed with ovarian cancer. This type of cancer is more common in late adolescence and early adulthood. In an advanced stage, it is not always possible to identify symptoms. However, some symptoms are common in early cases of ovarian cancer and may include frequent swelling. One of the most common signs of ovarian cancer is a feeling of regular bloating. This may be accompanied by pain in the lower abdomen, which is often mistaken for menstrual cramps. Some women may also experience constipation or diarrhea. Although it is normal to feel bloated after eating, some women feel this sensation more frequently than others. If you experience bloating accompanied by pain or other unusual symptoms, it is important to consult your doctor to rule out ovarian cancer as soon as possible. Number 2, back pain. Pain in the lower back or pelvis is often one of the first signs of ovarian cancer. It may worsen after menstruation or bowel movements and may be persistent or painful, usually occurring in the pelvis or abdomen. It extends to the groin area. The pain may be constant or come and go. but it may seem like a dull pain rather than a sharp pain. It may worsen with effort, such as coughing, sneezing, or lifting heavy objects. Number 3. Constipation. Constipation is a common symptom of ovarian cancer. Constipation occurs when the intestines in the colon become hard and dry due to a lack of water and fiber. This may be due to the tumor pressing on the colon or rectum. The tumor may also cause the muscles of the intestine to contract, which can make it difficult to have a bowel movement. Changes in bowel movements related to ovarian cancer include less frequent bowel movements than normal, feeling bloated or full after eating, straining when trying to have a bowel movement, and having fewer normal bowel movements than usual. Are you enjoying our video so far? Before moving on to the next symptom, don't forget to click the like button and subscribe to our channel to never miss our new informative videos. Number 4. Fatigue. Symptoms of ovarian cancer may include fatigue. Fatigue usually appears gradually and may be accompanied by other symptoms of ovarian cancer, such as loss of appetite, bloating, and indigestion. The symptoms of ovarian cancer are vague and non-specific enough to trigger a diagnosis. Many women attribute their symptoms to stress or aging. As a result, most wait too long before seeking treatment for ovarian cancer. Number 5. Pain or discomfort in the abdomen or pelvis. Another common symptom of ovarian cancer is abdominal pain. Cancer generally does not cause pain in these areas until it develops into advanced stages. The level of pain may vary, and many people with ovarian cancer do not even realize they have the disease until they are diagnosed in stages 3 or 4. That is why regular screening exams are important, as they can detect the disease before symptoms appear. Apologies for the cutoff. Let's continue from where it left off. Number 5. Pain or discomfort in the abdomen or pelvis. Another common symptom of ovarian cancer is abdominal pain. Cancer generally does not cause pain in these areas until it develops into advanced stages. The level of pain may vary, and many people with ovarian cancer do not even realize they have the disease until they are diagnosed in stages 3 or 4. That is why regular screening exams are important, as they can detect the disease before symptoms appear. Number 6. Feeling full quickly when eating. Many women feel full after a meal and cannot eat more than half of what they usually consume. Some feel sick if they eat too much and may also experience diarrhea, nausea, and vomiting after eating. Feeling quickly full or bloated for no apparent reason are common signs of an enlarged stomach caused by the buildup of fluid from an ovarian cyst or tumor pressing on nearby organs or other structures in the abdomen. Number 7. A frequent and urgent need to urinate. The most common symptom of ovarian cancer is a frequent and urgent need to urinate. This can be caused by an enlarged pelvic tumor pressing on the bladder or the ureter, which is the tube that connects the kidneys to the bladder. Even if you have experienced frequent urination before being diagnosed with ovarian cancer, it is still important for women to pay attention to these symptoms, as well as other changes in bowel habits. Number 8. A change in the menstrual cycle. Symptoms of ovarian cancer vary from woman to woman, and some women do not show any symptoms. Many doctors recommend that women be screened for ovarian cancer from the age of 35, but it is important to know which symptoms to look for regarding menstrual cycle changes. An irregular menstrual cycle is a sign of ovarian cancer that many women do not pay much attention to. It is common to have an irregular menstrual cycle as you approach menopause, but it is also wise to talk to a doctor if you have difficulty eating a lot. Women, especially those who are busy or stressed, often experience nausea and stomach pain. Although occasional difficulty in eating is not a cause for concern, it can be a sign of ovarian cancer, often an insidious disease, because it may not cause any difficulty in eating until it spreads to other organs in its early stages. Ovarian cancer diagnosis generally grows slowly and may take years to evolve to an advanced stage. The earlier it is diagnosed, the better are your chances of successful treatment. Especially when it comes to curing, the first step in diagnosing ovarian cancer is an abdominal ultrasound, where the doctor uses a probe that emits sound waves to create images inside your abdomen. The doctor will also perform a pelvic exam and possibly a computed tomography scan. The CT scan can be used to look for tumors in the ovaries and other nearby organs, including the colon, bladder, and rectum. If the doctor suspects cancer, he may recommend an MRI, positron emission tomography, or a biopsy. A biopsy occurs when tissue samples are collected from suspicious areas of the body and examined under a microscope. For treating ovarian cancer, treatment options vary depending on the stage and type of ovarian cancer a woman has. Surgery is often used to treat cancers in the early stages, while chemotherapy and hormone therapy are used along with surgery for advanced stages. Surgery to remove an ovarian tumor is called laparotomy. Depending on the location and size of the tumor, your doctor may perform a laparoscopic or robotic approach to remove your ovaries during a laparotomy. Your surgeon makes a long incision in the abdomen, usually horizontally, which allows access to the organs within the abdomen and to remove any tumors found there. If you have cancer that has spread beyond the ovaries to other parts of the body, such as the lymph nodes, this procedure can also be used to surgically remove those areas. However, if all evidence of cancer is removed, there is no need for further treatment. Chemotherapy may be used to shrink a tumor before surgery, or may be used after surgery to kill any remaining cancer cells. It is also administered after surgery to help reduce the risk of ovarian cancer returning. Chemotherapy may be used alone or with other treatments for ovarian cancer, often used with radiation therapy to treat ovarian cancer that has spread to other parts of the body. The 5-year survival rate for women with early-stage ovarian cancer is 92%. For women with advanced stage disease, the 5-year survival rate is approximately 17%. We hope that reproductive cancers, such as ovarian cancer, will be much less threatening in the future. Until that day comes, there are steps you can take to improve your chances of early detection. The sooner it is detected, the better are your chances of beating the disease. Therefore, never hesitate to ask questions about symptoms or risks when visiting your doctor. Did you like this video? Press the like button and subscribe to our channel for more informative videos like this one. Thank you for watching.